Haynes, psychologist and general board member representing the International Federation for Therapeutic and Counseling Choice. We use evidence-based methods and well-established practices therapists use around the world and never use aversive or coercive methods. We oppose this bill. Same-sex attraction and incongruent gender identity are not simply biologically determined or who someone biologically is. The American Psychological Association's APA Handbook of Sexuality and Psychology says there are psychoanalytic causes. It said childhood sexual abuse may be a cause for some people having same-sex partners. Rigorous studies in the US and Finland have found that psychiatric conditions and suicidality often exist before onset of adolescent gender incongruence, therefore may be causes for it. Treating causes may reduce resulting sexual attraction or gender feelings. These are professional organizations worldwide. There are organizations that support the right to this therapy. For people who do reduce same-sex attraction through therapy, psychological well-being strongly improves. Even for people who do not change, they continue to identify as LGBT, suicidality decreases. The leading study claiming harm, Blaznic 2020, used data collected for the LGBT affirmative Williams Institute at the University of Los Angeles. This study failed to compare suicidality rates before and after therapy. Studies that have been referred to today claiming proof of harm do not compare suicidality or psychological problems before and after change exploring therapy, and admit their methods do not rightly allow them to conclude therapy causes harm. Harm-claiming studies regularly make this mistake, and professional organizations have claimed harm based on them. When Sullins in 2022 corrected this mistake using the Blaznic dataset, the results turned upside down. Most of the suicidality was before therapy. Suicidality rates he found and harmful behaviors mostly were for people occurred before therapy. Suicidality rates for people who do not change decreased to 5 times lower after change therapy. The United Nations has no binding treaty that mentions change exploring therapy. Many UN nations oppose a therapy ban. For adolescent gender dysphoria, change exploring therapists follow Finland's first-line government recommendation to resolve gender dysphoria by resolving predisposing disorders and not changing bodies. HF2156 punishes Finland's first-line government recommended treatment for adolescent gender dysphoria. This is a disaster. There is not professional consensus in support of HF2156. I urge you, vote no.